Hello everyone, my name is Ese Megege and I'll be presenting on Koro epidemic. Before I begin, I would like to take a moment to thank you, my audience, for sharing your time with me today. I know your time is very important and I really appreciate that you spending it with me. Why listen to this presentation? Well, I'll give you 3 reasons why you should. In this presentation, you'll probably learn and discover something you have not heard before. You'll have fun, and if you find yourself laughing at some point during this presentation, it is okay. It is expected. Another expected reaction is disbelief. You'll probably be blown away in disbelief by this presentation. I'll also bring you several years of personal experience in the subject matter we'll be discussing. This is certainly a presentation you'll remember for a very long time. So let's dive right into it. Shall we begin? Koro epidemic is a disaster by definition. According to the dictionary, a disaster is an occurrence disrupting the normal condition of existence and causing a level of suffering that exceeds the capacity of adjustment of the affected community. Simply put, any event can constitute a disaster if it affects a large number of people and exceeds the community's ability to effectively respond in a timely manner. When a hazard meets vulnerability, a disaster occurs. A hazard is a trigger event like volcanic eruption, landslide, high winds, earthquakes, war, civic displays, such as that seen in Koro epidemic. There were civic displays and violence. When a hazard meets vulnerability such as poverty, lack of education, training, lack of resources, all of which were seen in Koro epidemic, a disaster results. So by definition, Koro epidemic is a disaster. The presentation outline is as follows. We will look at a general overview of Koro syndrome. We'll look at countries affected by Koro epidemic. We'll discuss management of Koro syndrome. We'll discuss how to prepare for service in Koro epidemic areas. And lastly, we'll talk about survival needs and how to address them. So why learn about Koro epidemic? It is my intention that by bringing awareness to you and other providers and the public about this subject, it will help reduce and possibly avoid the potential losses from Koro epidemic. It will assure prompt and appropriate assistance to victims when necessary. It will achieve rapid and durable recovery. So let's take a moment to imagine that we woke up from sleep one day and found that our genitals were gone. What would be our reaction? That's right. We might become hysterical. That's exactly what happened in Koro epidemic. People lost their minds. There was mass hysteria. Just imagine we were no longer in possession of our genitals. How would that feel? Koro syndrome, also known as the magical genital loss syndrome, is a psychological disorder. In Koro epidemic, an epidemic of the mind, there were mass psychotic outbreaks reported in certain parts of the world. As part of an NGO, how would you respond to a mass psychotic outbreak? Koro epidemic was reported in China in the year of 1948 through 1987, there were 6 outbursts reported during this time. Koro epidemic was also reported in Nigeria in 1970, in 1980, in 1996, and there was one in 1997 that spread through other African countries like Cameroon, Ghana, Ivory Coast, and Senegal. There were outbreaks in Sudan in 2003, in Gambia in 2003, in Congo in 2008. Koro epidemic was also reported in Southeast Asia, Singapore in 1967, Thailand in 1976, Northeast India in 1982, South India in 2010. There were also outbreaks reported in the United States and Europe, such as Russia, England, Canada in the 1880s. So what is Koro syndrome? Koro is from the word Kurou from Mali that means tortoise. A tortoise, as you know, is a reptile that retracts its head into its body. That's exactly what Koro is. Koro is a sudden severe anxiety that the penis, and in females the vulva and nipples, will retract into the body and cause death. Koro is also referred to as the magical penis loss syndrome, and in Cantonese it's called Chukyang. In Assam it's called Jinjinia. There are 3 components that must be present to diagnose Koro syndrome according to DSM-5. There has to be a perceptual component, and this is when the patient reports a perception that the genital, or sometimes the tongue, receded into the body. A cognitive component is when the patient reports a belief that the retracting genital will cause death. And the emotional component is when there is fear, anxiety, or panic about impending death. So again, all 3 components must be present to diagnose Koro syndrome. Do not confuse Koro for a buried penis. A buried penis is a condition where the penis is hidden by pubic fat or by the abdomen. A buried penis is typically seen with other medical conditions like infections, lymphedema, scleroderma, ascites, obesity, diabetes, and so forth. It is important that the provider is able to differentiate between Koro and a buried penis. One study reported that several urologists misdiagnosed their patients who actually had urological issues with Koro syndrome. You do not want to be in that boat. The presentation of Koro syndrome in West Africa and Nigeria is slightly different from that seen in China or in India. The provider is able to diagnose Koro syndrome in the African and the Nigerian population using 4 identification clues. The cue. The patient would report an attacker, and they would typically say that they had some sort of body contact with the attacker. Either they shook hands or the attacker accidentally bumped into them. That's the clue. The flash. The patient will report a strange body sensation or an electrical body shock after the handshake or the body contact with the attacker that traveled down through their body to their genitals, which made them check their genitals, and that's the check. And when they checked their genitals, they discovered that it was missing. So they called out for help, and that's the alarm. The patients usually call out for public help. In the Yoruba tribal group, The alarm usually goes as follows: Ole okumitilu, ole okumitilu, which means thief, my genitals have been stolen. Following this alarm, the public would react by finding the attacker and beating the attacker up, sometimes leading to death. Several reports have reported multiple deaths in association with Koro syndrome, or specifically in association with the violence from these public displays. So what's the aftermath of Koro syndrome on the hospitals and the community? The hospitals report increased burden. They report increased patient load. They are seeing more cases of panic attacks, more cases of anxiety related symptoms, such as some patients come in with syncope, epigastric pain, gastritis, palpitations, supraventricular tachycardia, GI symptoms, diarrhea, MSS. Some patients do report genital itching, headaches, insomnia, and also traumatic injuries from the violence that results, and then just stress-related symptoms. And also there are flare-ups of underlying psych disorders. I'd like to take a moment to emphasize here that mass psychogenic illness like Koro is underappreciated, underreported, and poses a significant health and social problem. The financial impact includes cost of testing to eliminate environment and organic causes when these patients do present to the hospital. And also the response by the emergency services and public health specialists who expend precious time and resources taking care of these patients. Schools and factories were temporarily closed, resulting in loss of production and income, and educational outcomes were disrupted. Several reports state that there were a huge and enormous financial burden reported by several communities and countries. When providers challenge the conditions of the patients lose confidence in the health system and just do not show up. They just don't go to those places, to the health facilities. So they end up leaving with their anxiety symptoms, and this fear continues of this fear of genetic loss or genital loss. I apologize. So it is very important that as providers we understand the cultural values of these patients, and it might make it easier for them to trust and perhaps be more willing to listen to us. Outside of a cultural context, it is very difficult to diagnose Koro syndrome. So how do we treat Koro syndrome? It is mostly symptomatic treatment. You treat the anxiety-like symptoms. So for instance, if a patient comes in with epigastric pain and you suspect it's gastritis, you can give a PPI. If a patient comes in complaining of insomnia from excessive worry and that they lost their genitals, you can give them sleeping aids. Psychopharmaceuticals such as benzodiazepine like Ativan and Xanax have been used short-term. SSRIs like Lexapro has also been used. And then for the underlying psychosis, you can refer them to cognitive behavioral therapy and psychotherapy. It's important that we're doing a lot of education to this group as well as to the public to eliminate the belief and also to reduce violence. So who is at risk? The poorly educated individuals are at risk. Individuals with strong religious and cultural doctrines, individuals with strong belief in superstition, individuals facing extreme poverty, and individuals with underlying mental disorders. All of those are risk factors for Koro syndrome. So, as part of an NGO, you are called to serve in a Koro epidemic area like Nigeria. How would you prepare? So the mnemonic for preparation is get 8. And get 8 is basically the 8 things that you need to do to be prepared for your trip, for your mission trip. And they are get vaccinated, get visa, get flight and accommodation, get fit, get packing, get money, get emergency contact, get enough rest. We'll go over some of these in details. The rest are pretty self-explanatory. So get vaccinated. Traveling to Nigeria, you would require the following vaccines. On top of that list is an anti-malaria prophylaxis. You will need to start your anti-malaria prophylaxis before your trip. So if you're planning to go to Nigeria, you would need to start early. You need to start planning early. Chloroquine, for instance, is it's one of the pills we give for prophylaxis, for malaria prophylaxis, and that is usually started 2 weeks before the trip to Nigeria and continued for 4 weeks after return from Nigeria. My to-go anti-malaria pill is Melaron, and that is taken 1 to 2 days before your trip to Nigeria. And you only take it, and it's once a day dosing, and you only take it for 7 days post exposure. So after you return from Nigeria, you take it for 7 more days as opposed to 4 weeks if you take chloroquine. Other vaccines, and there is also an anti-malaria vaccine, but that's only available to children ages 5 months and up. So other vaccines are chickenpox, tetanus, flu, MMR, polio, shingles, hepatitis A, hepatitis B. Non-vaccine requirements: you want to avoid contaminated water and soil. You want to avoid teeth bite, and avoid touching animals. Don't touch the cows. Also, tuberculosis is present in Africa, and as you probably know, tuberculosis is spread from inhaling droplets of contagious person. So you definitely want to be aware. Don't sit next to anyone who's coughing, especially coughing up blood. Get visa. The next thing you want to do is get visa. A visa can be obtained online or in person. Just register with the Nigerian Consulate House, and there are several locations in the United States. There's one in New York, there's one in Texas, there's one in Washington, D.C., there's one in Atlanta. You will need a valid passport with expiration date more than 6 months from date of travel. For your personal protection survival needs, you want to pack head coverings. It is very hot in Nigeria. It's about 100 degrees. You want to definitely get a sun hat and cover your ears. I was in Nigeria about 6 months ago, and I was only there for 1 week, and I lost 6 pounds just from sweating. I like the merino wool pants and jeans. I tend to find that they are more breathable and they're very useful in the hot weather, in my opinion. You want to pack cotton shirts and shorts and waterproof jackets, ultralight rain jackets. You want to pack at least 2 to 3 changes of underwear, 5 to 6 pair of socks. You want to pack lightweight trail runners and sneakers and lightweight and sandals. You want to definitely pack a high SPF sunscreen for sunburns. You want to pack water purifier, and that water purifier, we'll talk more about it under the water and food survival needs. You want insect repeller lotion and spray, definitely aloe vera. I find aloe vera very useful. Anti-diarrhea pill, definitely it's a must. Because if you're interested, if you want to eat African delicacy, I strongly recommend that you take an anti-diarrhea pill with you when traveling to Nigeria. For water and food survival needs, as I said, you want to take your water purifier. You want to pack plenty of water, a gallon per person per day. You also want to take comfort foods and ready-to-eat canned meals. So also have your protein and fruit bars, dry cereal, granola, and canned juices, and high-energy foods. Now, for your signal survival needs, the enriched satellite phone, it's probably useful in these areas. Well, I should take that word probably, because I'm saying probably because I have not tried it, but I hear it's pretty good. It's the enriched satellite phone allows a two-way text conversation with first responders and others. It allows you to communicate with your friends and your family long distance. It can be used to get weather forecasts and can be used for navigation and mapping. Other signal devices to pack includes a whistle, flashlight, radio to listen to local news, your local map, and GPS, and commercial signal devices. For your mental health survival needs, I would recommend that you make plans to see festive shows in Nigeria. You can take nature walks, and you can take a cooking class to learn to prepare Nigerian delicacy. Go to the zoo, or you can attend musical events. Pack family photos and just personal and plenty personal symbolic items. So, in the event that plans change when you get to Nigeria, perhaps there might be a safety concern, I strongly recommend that you exit out immediately. Just leave. So I will prioritize travel needs if there are safety concerns. Get a travel insurance. I recommend that if you're traveling to Nigeria, get travel insurance to give you the flexibility of changing your flight at will. Know the address of the international airports. Reside close to the airport if you can as your travel data approaches. Use travel agents because the internet is not really reliable in certain parts of Nigeria. So if you have to buy your flight like last minute, you might not be able to. You definitely want to have other choices such as using a travel agent to buy your flight. Arranging transportation to the airport, it's pretty easy because there are so many commercial vehicles, yellow cabs, and means of transportation. Getting to a certain part or getting to different parts of Nigeria, it's not a problem because there are transportation available. There will always be transportation available. You can have the hotel arrange your transportation, arrange a pickup for you if you want. You could have your own personal driver. That's also possible. Or you could just walk out on the street and stop a yellow cab. The second need I would prioritize is staying hydrated while you're doing all of this. Stay hydrated. It's very hot in Nigeria. You definitely want to be well hydrated. So in summary, I would highlight the main points of this presentation. Why take this serious? In African countries and other parts of the world, Koro cases are poorly identified due to clinicians' lack of exposure and proper education in this area. It is important that providers understand illnesses specific to certain cultures and geographic areas. Koro epidemic have occurred in India, China, and multiple countries in Africa, Southeast Asia, and Europe. Communication between providers from different cultures can aid with the early diagnosis of Koro syndrome. In conclusion, screening for Koro in high-risk populations should start now to reduce the occurrence of Koro epidemic. Attaining thorough sexual history is helpful in early diagnosis. However, how many providers screen for culture-bound syndrome like Koro? How many providers ask their patients these core screening questions? Do you feel like your genitals are shrinking? And does this frighten you? I will now leave you, providers, to contemplate on these questions. If you want to learn more about Koro syndrome, these are my references. You could look them up. And I thank you for listening to this presentation.